Okay. A little bit about the Hertie Asia Network. We are a student and alumni-led initiative that aims to bring together experts in the fields of business and public policy from Asia. So today's panel is part of our knowledge sharing series. It's a packed session today. We'll be discussing India's health ecosystem since the COVID-19 pandemic, as well as the government's big push for an open digital healthcare system. We'll be hearing from our guest speakers as well on how healthcare entrepreneurs and policy experts from outside India can be a part of this exciting space. So our first speaker today is Pranay Patil. He's a public health expert with over 7 years of working experience with Asian Development Bank, the Indian federal government, and various state governments in India. He's currently an innovation strategy consultant at the Wish Foundation, a healthcare nonprofit. Pranay was also the founding member of the Government of India's National Health Authority, where he led a number of innovation-friendly initiatives. Pranay is an alumnus of the Indian Institute of Technology, Hyderabad, and Ashoka University. Okay, our next speaker is Pavan Ananth. He is the founder and CEO of Pravesh, a boutique go-to-market consultancy focused on introducing and scaling global healthcare innovations in India. He has over 7 years of experience developing markets with the federal government and various state governments and private healthcare enterprises in India. Previously, he led the entry of Zipline, a drone logistics enterprise from California, into India, and he has led a number of innovation projects from the Chief Minister's Office, Government of Haryana. Pavan is an alumnus of Nanyang Technological University in Singapore, and he is a Young India Fellowship Scholar. So please feel free to raise your hand or type in questions you have, and we'll answer them at the later part of the session. So without further ado, my first question goes to Pranay. So Pranay, please give us an overview of what the health ecosystem in India is like now, particularly after India's big digitalization push, the Ayushman Bharat Digital Mission. Pranay, please.
Yeah, absolutely. Thank you. Thank you so much, Ashley. And as you rightly pointed out, India has seen a very big push towards making digital health happen. And before I come to the Ayushman Bharat Digital Mission, I think it is pertinent to just understand a little bit more in terms of how the Indian healthcare scenario has progressed. Over the past 5 years, we've seen governmental push under the banner of Ayushman Bharat happen at the primary health level, wherein the Ayushman Bharat HWCs is looking at really augmenting and making 150,000 primary healthcare centers become digitally driven and digitally compliant. We've also had India's universal health coverage scheme, India's social health protection scheme called Ayushman Bharat PMJay, which is really creating financial protection for 500 million Indians. And the good part of the scheme is that it is completely cashless and paperless, right? So we are looking at digital infrastructure being created. Now, at the context and the pretext of these schemes coming in, wherein primary healthcare, wherein you're looking at digitally empowering primary healthcare, wherein you're looking at digital medium to provide secondary and tertiary healthcare to a vast majority of Indian population, it was time for a big change like the Ayushman Bharat Digital Mission to kind of come in. The Ayushman Bharat Digital Mission is also a manifestation of two very big initiatives that have happened in the past 5-6 years. The first one was the National Health Digital Blueprint, which really set up standards and systems and processes on how a digital ecosystem could look like. And the second initiative that the government of India looked at was the health stack that was developed in terms of really how the government can create a broader framework of the baseline building blocks, wherein public entities and private entities can build their products and services over and above it. So I think there was a lot of base that was set for the digital health mission to kind of come and play its part. And I think the time had never been opportune. The digital health mission came into being when India was under the wrap of COVID-19 wave. And I think as we are progressing towards a world wherein wherein we are looking behind COVID, and wherein we are moving to a system wherein we are looking at more digitally empowered tools, wherein we are looking at more digitally empowered healthcare systems. I think the Ayushman Bharat digital system, the Ayushman Bharat digital mission is really setting up those building blocks for healthcare innovation to happen at the public healthcare level, but also at the private healthcare level, because the government is really taking a mighty role in kind of reducing the fragmentation and kind of streamlining the processes. So I'll take a pause here, and maybe in the next questions we'll kind of further elaborate on how the digital mission is going to create the impact that it is intended to do.
Okay, so I thank you, Pranay. I think now is a good time to bring in Pavan. So Pavan, what can you tell us from the perspective of an entrepreneur? Like, what's the scene like from your point of view? Pavan, please.
Great. Yep. No, thank you so much for the question, Ashley. And it's also great to be here at this platform. So I think firstly, thank you to the Hertie team for organizing this. Just building off of Pranay's points on the landscape and the ecosystem that has become so friendly, and that has also the platform that has been set up by the government. There's been, I think, the healthcare in India across the sectors, and whether you look at diagnostics, whether it's in healthcare access and delivery, even in healthcare insurance. There's been progress that's been happening in leaps and bounds, and COVID, that came in, and we are still, maybe we are in the fag end of COVID, but the 2 years also I think gave that push in innovation that was necessary, both from a funding perspective as well as from a startup perspective. And I want to kind of elaborate this by just giving a few examples. Taking telemedicine as an example. In I think just the last 1.5, 2 years, the government has really taken telemedicine seriously, although it's been around for a very long time, and there's been a lot of policy levers as well as interventions that have happened. It's just been spearheaded really, and kind of jumped up due to COVID really. And some of the classic examples are, there's a Swasth Health Alliance that came up, just around the time of COVID, and it's a great example of how volunteer doctors and healthcare professionals from across the country came together and provided remote diagnostic facilities, during the time of COVID. Another really, I think, a good example is, innovation that's also been spearheaded by institutions. So here, there's an entity called CCAMP, which is based out of Bangalore. It's a pseudo government entity that comes under the Department of Biotechnology, and they have done some amazing work in actually accelerating startups. So there's a thriving startup accelerator in the CCAMP, as well as specific programs that were run for during the COVID pandemic. One of it actually is in kind of mass production of diagnostic tests in the country. I don't think in any other country you would find a COVID test that can be taken for as little as $5 to $10. And this did not happen now. This happened like a year and a half back, like right into a few months as soon as COVID hit. So I think these are all excellent examples of the government, the funding agencies, and the startups really coming together, working in a very collaborative way through public-private partnerships. And yeah, I think really kind of, spearheading innovation. So it's an absolutely great time. Building on this, just one other example that I actually want to quote, and that's also close to me since I've been working in the space of drones, is, in how the country's made it a priority to improve healthcare access in some of the most remote areas through drones. And even in this, just in the last year, I think nearly 40 plus delivery trials have taken place where vaccines, blood, and other life-saving medicines have actually been delivered to some of the most remote parts of the country, in the Northeast, in tribal areas of various states. So I think that there's been a great momentum in the digital healthcare space, and as well as in the healthcare access and delivery space. Over to you, Ashley.
Thank you, Pavan. So, Pranay, maybe you can tell us a little bit. We have there was a question in the audience before in the registration form talking about data systems. Maybe you can touch a bit on that. So, the question was, does creating data systems for monitoring of public health services also count as digital health interventions? Maybe Pranay and Pavan can answer this. And if yes, what are some of the use cases in India? So Pranay, maybe you give us the public policy point of view, and then Pavan, you can come in with the entrepreneur, the market-based view. Thank you.
Yeah, no, absolutely. And I think I want to build on what Pavan said in terms of a lot of collaborative initiatives happening. In terms of data systems, I think the example that kind of rings a bell to me is the entire vaccination platform that the government of India created. It is still surprising to a lot of people in the Western world that India had completely digitized the end-to-end system for availing vaccination, be it booking an appointment, getting an appointment, to getting your certification online, and having a data storage and a repository wherein your certification is tied to your national ID, as well as your certification is tied to your mobile number. It is an absolutely flawless system that the government kind of devised. And this becomes a very good use case to look at how data systems how public data systems can really be created in order to effectively monitor the health of the broader initiative or the health of the broader program. For India, we had real-time update in terms of like how many people have gotten their first vaccination, how many people are due for the second vaccination, how many people need to get to the booster level, and to create this sort of a mechanism in a very time-bound manner was a huge feat during that time. And that is why I think there are a lot of use cases that have been developed by the government due to urgency and due to the necessity at those times. And that is why I'm very positive about the digital health mission actually reaching its impact in the stipulated time that it is envisioned to reach, right? Because creating that sort of a mechanism, India was perhaps the first country in the world to get an end-to-end vaccination platform up in place for 1 billion plus people, right? We're talking about a magnitude that was unprecedented and a system which turned out to be an absolutely flawless system. And I'd request Pavan to kind of really touch up and build more from the private lens as well as from the public lens as well. Pavan.
Sure, thanks, Pranay. Yeah, so I think from a high level perspective, yes, definitely creating data systems for monitoring public health services do count as digital health interventions, and this is not really new, right? I mean, we already have a huge range of data systems in the name of monitoring. There's various different government-led portals, health management information systems or HMIS. There's also something called IDSP, which is the Integrated Disease Surveillance Program, which is constantly active, kind of in the background to really look into what is the incidence of various different diseases across the country. So a lot of these systems already exist. You have also systems at a hospital level called e-hospital and so on, which are more into kind of the hospital management. These the government itself, I think in the last maybe a few 1 or 2 decades has taken a huge push towards building a lot of these systems. And as Pranay mentioned earlier, the whole health tech stack with the Ayushman Bharat Digital Mission has also helped a lot of private startups to plug and play and integrate on top of the government systems. So you have, for example, many private healthcare startups, which are open source and also which are, more private led, that are directly integrating into this tech stack. So, they are kind of like, reading into the HMIS systems and the portals that the government has already set up, to then, hopefully, I think, the idea is to create a, single source of truth with respect to data. The flip side of this is, I think, while a lot is happening, and I think there is no better time than now, I think, to be in this space, there are still challenges with respect to, I would say, the quality and the richness of the data, because it's sometimes the people who are actually entering the data are not incentivized to, build the, or, input the most accurate data. And these are your, healthcare workers, your ASHAs and your auxiliary nurse midwives, ANMs. So I think that's a challenge that we are solving right now. And then the second thing is, how do we use this data? So there's a lot of data, I think, that's been built up, legacy data, new data that's coming in every day, at a population level, at a disease level, and so on. But the question largely still remains, how can we put it to better use? And here, I think a lot of, again, new startups are coming up that are, able to do real-time analytical dashboards, that are actually, helpful for decision making at all levels, from the highest, health ministry level to, at a village level and at the ground level. So I think, there's several use cases from a government and a private perspective, and yeah, there's also some challenges that need to be solved, which definitely creates a big opportunity.
Thank you, Pavan. So actually, I have a question about what both Pavan and Pavan and Pranay. So Pranay, you mentioned that it was such a feat, for the Indian government to really digitalize the entire vaccination process for 1 billion people. So, since the COVID-19 pandemic, how has the bureaucracy been, as in terms of timing? How did the government themselves overcome the timing, the approvals? How did they get it up so quickly? And is it still that quick to get things running from Pavan's side? Is there still a lot of doubt about digitalization, a lot of pushback? What's the mindset around that now?
Yeah, no, that's a very pertinent question, and I have worked with bureaucrats at the state level and at the federal level for close to 5 years now. And I think what I can vouch for is that the urgency and the necessity if there's a political will, I think there is nothing that can stop the Indian bureaucracy in kind of really attaining the highest feat with the highest quality, right? Just to substantiate this claim, I was in the founding team at India's National Health Authority, which ran the insurance scheme as well as which runs the digital health mission, right? And progressively, when I used to chat with a bunch of my friends who used to work in the private sector, a lot of times the response that I got from my friends was that you are exactly working in a startup-like ecosystem, right? And this is largely a manifestation of dynamic leadership really finding their place for flagship initiatives. We also have to recognize that many of the schemes that have been released, that have come up in the healthcare in the past 3 to 5 years, have been the flagship projects for the Indian political leadership, right? So it was widely proclaimed that India's universal health coverage scheme was the pet project of the Prime Minister and the political leadership. So when there was political will, it was every approval and every initiative kind of found its way. Just give me 5 seconds. There's a disturbance at my end. Just give me 5 seconds.
So, oops. Okay,
Sorry for that. So our working, we were a small and lean team of around 40 people when we had to roll out perhaps the biggest publicly funded healthcare scheme in the world. And the core team of 40 people was able to bring this out in a span of 5.5 to 6 months. And similarly for the digital health mission as well, there was a small core team of around 30 to 40 people who was working on the mission and was really able to thrive this. And this was a function of a lot of approvals falling in place, a lot of charismatic leaders really coming in and pitching in. And the National Health Authority remains the de facto bastion for a lot of civil servants to find a lot of civil servants to find an opening into working at the national level, right? So it is looked at as a very big opportunity, an opportunity which can really give civil servants an opportunity to make a difference and create their legacy of sorts. So I think like these are the things that need to be kept in mind, and I think there's no dearth when the political will is there and when you have a program that needs to run on the mission mode.
Great, thanks, Pranay. Yeah, I think I definitely echo Pranay's sentiments in the sense that, you know, and I've seen this happen in a lot of ways, even in my earlier role when I was at the innovation office in the innovation cell in the chief minister's office in Haryana, where I think, you know, when there is will, you know, it kind of happens. But I do want to caution that a lot of things have to come together, right? It's you need political will, you need administrative, you know, kind of like push. So this is, you know, where your bureaucrats and all of them come in, and then there needs to be a big push. You also need the idea, or, you know, what needs to be done to be economically feasible. India is a very, you know, price sensitive market, right? So I think, you know, if there's going to be, you know, something that's revolutionary, you know, if and maybe the startup is designing something that's going to be like, you know, out of the world in terms of, you know, something in digital health, but if it is still not you know, contextualized to, I think, an Indian audience, both with, you know, with respect to the usability, with respect to the cost, you know, I think a lot of factors need to be taken care of before, I think, you know, the will and the administrative, you know, kind of backing comes to such ideas. So I think, you know, economic feasibility, political, you know, motivation, or, you know, political inclination, as well as administrative push, I think all of this is necessary for any idea to be successful. And there are, I think, you know, many examples. The one that I mentioned earlier, actually, you know, rapid indigenization of diagnostic testing for COVID in India. All of that happened in a matter of like 3 to 4 months. Everything was fast tracked. This was directly led by the office of the principal scientific advisor, who kind of reports directly into the prime minister of the country. So these initiatives were led directly from those offices, and it moved, you know, at almost like a lightning pace, you know, like faster than it can move in, I think, any country in the world. A funny example actually is I recently applied for my new passport, and I got my passport in 2.5 days. This is unheard of in any country, I'm sure, but in India, you know, it doesn't matter, you know, it's healthcare is one thing, but even so many other services, you know, things can happen really fast when there is push. Now, that being said, you know, from a startup perspective, it's also important to know who are the right people to talk to. So there's, you know, there's of course the aspect of timing that's always important for a startup, right? Like with, you know, is there a need for such a solution in India? So there is the whole timing aspect of it. There is also the whole aspect of, you know, how is my solution going to cater to the Indian specific audience? You know, is it more targeting the urban or the rural or the large, you know, population that is, you know, in between the urban and rural? So it's not really, I mean, India is, you know, geographically spread so vast. So I think the second aspect is on who's your target audience. And then the third is also on, you know, who do you want to talk to? Like, you know, a new startup can, you know, be in India, they can, you know, have conversations with so many different folks in the country, you know, for like months and years, and might not make any progress. And the reason might mainly be because you're not talking to the right folks, you know, whether it's at the administrative level or whether it's at the political level. So I think all of these require a top-down push through the political administration, and also a bottom-up stewardship through your end users, which are your healthcare workers, your ASHAs, your ANMs. Unless both of this is, you know, kind of taken care of for a new, you know, solution, I don't think it can be, you know, really successful. So yeah, that's just a little bit of my perspective.
Thank you, Pranay and Pavan. So just at this point, I just wanted to do a little bit of summary for, especially for those people who have just joined us or joined a little bit late. So today we are speaking with Pranay, India healthcare expert, as well as Pavan, who is the CEO and founder of a go-to-market innovation consultancy for India. So at this point, if you have any questions, please do type into the chat, or just raise your hand, and we'll try to make sure to call your name. So next, while we are waiting for questions, I just wanted to ask as well. I mean, both of you, Pranay and Pavan, you've already touched a little bit on this. How is the healthcare sector in India different from other countries like the US, Europe, and Asian regions? And another question, but I think you can take it together. It's, do you consider that in some length, the reality of India during the pandemic was similar to countries in Latin America, for example? What recommendations would you give to the Latin American region in order not to waste efforts in tackling the health emergency? So how do you want to take apart this question? Maybe Pavan or Pranay first. I mean, before that,
I'll let you go first.
Sorry, Kate, do you have something to say? Sorry, we have a raised hand. Kate, please.
No, I have a question. I can wait.
You want to wait? Okay, so after this, we promise to go to Kate. So Pranay, Pavan, whoever wants to tackle this question first.
Let me actually take a crack initially at the first question that you raised in terms of really how healthcare in India is different from a bunch of other countries that you mentioned, like the UK or the US. I think India is a very interesting example because if you look at most of the countries in the West, they typically have a particular model of healthcare that the country has resorted to, right? In US, it is mostly insurance driven. It is mostly private sector driven, and it's super expensive, right? Whereas if you go in the European region, you'll see that healthcare is mostly public. It's mostly affordable for all the people. It comes under the mandate of social security, and the government kind of bears the risk for a lot more population. India is an interesting example in the sense that India has both a robust public sector market as well as a private sector market. However, if you really look at the contribution of the public sector only underwrites around 30%. The public sector actually caters to around 70% of the population, but in terms of money, public sector only kind of caters to 30% of the money that is being spent on healthcare. Whereas private sector really caters to 15, 20, 25% of the population, but in terms of money, around 70% of the money is kind of pumped into the healthcare sector by the private folks. So healthcare in India is very fragmented. The government does its bit. The private sector is super fragmented. There's no entity that kind of binds the private sector, and there are a lot of lapses in terms of the data that is there, right? How many hospitals are there? How many doctors are there in India? What are the kind of different disciplines of healthcare? So you not only have the typical allopathic doctors that are there in India, but India also has a very huge personnel of healthcare from what we call the Ayush domain, which includes Ayurveda, which includes homeopathy, which includes Unani. And India, and as you go down to the rural India, there's also a very high proportion of population which is catered to by quacks, right? So when you look at the entire healthcare scenario, there's a lot of fragmentation. There are a lot of therapies that are being utilized in the country, and in terms of cost, you really have to shell out a lot of money. Most of the because of the access, affordability, and the quality problem that kind of plagues the entire country. We have underwritten the costs for inpatients, for the most poor and the most vulnerable. but outpatient care is still being borne by the patients. And outpatient care actually contributes to the highest healthcare burden in the country in terms of absolute numbers, right? So just to summarize, I think India is different because it is highly fragmented. There are a lot of therapies that are active in the country, and we do not currently have a data system as such, which kind of includes the entire data of how many facilities do we have, how many personnel do we have, how many nurses do we have, etc., to make data-driven decisions as of now. And this is the broader problem due to which the digital mission has come into play. And this is the baton that the government has taken on its head in terms of creating a doctor registry, in terms of creating a pharmacy registry, in terms of creating a healthcare personnel registry, in terms of nurses and paramedics, etc. So these were my inputs in terms of the healthcare in India. Pavan, anything that you'd like to add on?
No, actually, I mean, I think that was an excellent answer. I don't think I could do better than Pranay really laying out the kind of the overall landscape, and also touching a lot upon the challenges. I think this is all the more reason why I would say the need of the hour is on collaboration between governments, funding agencies, private startups, to come together and build better data systems. Like there's I think so much of data out there, but I firmly believe that it's not being utilized the way it should be. So building data systems, building better analytics, using data science to really, I think, look at population level data as well as everything that Pranay mentioned, right? How do we identify who are the people who are still having out of pocket expenditure? So despite primary healthcare actually in India being completely free, a lot of people end up spending a lot. This is, of course, due to lack of awareness, lack of data. So I think a lot of these solutions coming together is going to be really beneficial to then kind of, address a lot of the challenges that Pranay actually spoke about. And I think your other question, Ashley, was on the LATAM.
The LATAM market.
Yeah.
It was.
Should we take that real quick? Or?
Yeah, would you be able? Yeah, just one real quick. So, do you consider
sure.
the of India, during the pandemic was similar to LATAM?
Sure.
And what recommendations
and what can they do
in order not to lose efforts in tackling the health emergency? What have we learned?
Yeah. No, so I think, for the question on was the pandemic in LATAM similar to that in India? Perhaps. I'm sure there are certain countries, certain pockets in LATAM. I mean, Latin America is pretty big with so many countries, right? So I'm sure there are similarities that can be drawn between what happened here and what was there. Like for example, the first wave in India was relatively mellow, and it did create a sense of complacency in the country, right? Which then the second wave, when it actually hit, and it was pretty devastating. And I think a lot of LATAM countries also went through similar kind of COVID waves. The healthcare system also may be similar. The one thing that I do want to touch upon is social security and insurance, or the safety net that I think both for people in India and LATAM have might be very similar. I think most people in LATAM that I understand are also denied access to quality healthcare, primarily because they don't fall under the insurance system. So there's, I think, several interventions that can be perhaps be implemented here. For example, the use of micro insurance, which is a sort of a community insurance system that's actually controlled within the community itself. So it can be implemented at a much more decentralized level, and this has a lot of benefits to reduce the social exclusion that may be present at the moment. So this could be maybe perhaps one of the I would say maybe interventions that several countries in LATAM are already looking at. But I think improving the social safety net is really critical. Any thoughts, Pranay, that you would like to add?
No, I think like you gave a lot of interesting points. I think perhaps one of the things that can really be replicated from the Indian example, especially in the pandemic situation, is really leveraging the power of data systems, right? Be it for the vaccination, be it in terms of just testing, tracking, tracing the pandemic cases and kind of bringing it at halt. And I'm really talking it from a very macro perspective in terms of what policymakers can really dwell in and what policymakers can really make certain decisions on. So I think like these are the avenues that I believe India could be a potential reason. India could be a potential case studies for not only the LATAM region but for the broader global South to look up to in terms of really how do you make sense of the data that you're collecting and how do you utilize the data in order to make better decisions.
Just before we jump to the two questions on the screen, just one quick thing that I just wanted to mention is, despite the second wave being devastating in India, there was so many different promising practices that actually happened. And I was I was part of this team that led a project from June to December last year to document 60 plus promising practices that happened in India to beat the pandemic, from vaccinations to collaborative partnerships to evidence-based policies and evidence-based hospital management. I'm happy to kind of like drop a link or something to this platform. So there's a portal, we have documented all of these promising practices, and I think this is universal. I think every country can learn from each other. There's going to be similar challenges, and this portal itself is, I think, a really valuable resource to learn from. And I'll also drop the note in the chat. Sorry for the interruption. We can go to the other questions.
No problem. Thank you. Okay, I promised to go to Kate before we go to the questions on in the chat. So Kate, please.
Privilege. Thank you so much for having the conversation. I really think it's super interesting to hear like both sides and multidimensional. So the question here is kind of based on my personal experience, because I studied public policy and then I am a startup owner. So I also advise like startup owner about their strategies, positioning, and I don't know, whatever associated with venture capital investment. But then the question here is it a concern about compliance? Saying compliance, that's more individual level. So are you asking for consent? And then even upper level. So
Kate, I'm so sorry, but you are breaking up. So the last 2 seconds, we couldn't hear you. If you could repeat the last question. Still cannot hear you.
I think Kate dropped out.
Okay.
Joining back.
Let's go back to her later. So I want to go to Tanma's question first. Tanmay's question, which is about the private hospitals in the PMJay network.
Yeah.
So
this is squarely in Pranay's area. Yeah, go ahead.
I can actually take a crack at it. So if you look at the 500 million population that I was mentioning for the social protection scheme, for the healthcare social protection scheme, most of that population is kind of concentrated in rural areas, right? So if I were to divide India into tiers. You'll have metro, tier 1, tier 2, tier 3, tier 4, and the broader rural geographies. Now, the kind of hospitals that Tanmay has mentioned are the hospitals which are primarily concentrated in the urban sphere, right? So in terms of access to healthcare, these are entities which are anyways far from the broader population at hand. So and at the same time, these entities, if you were to look at the packages that the government has for certain procedures, these entities easily charge around 5x to 10x of those packages. Because healthcare model in India before PMJay was actually looking at low volumes and very high profit margins. With the coming in of PMJay, what has really happened is that the hospitals are kind of tweaking their healthcare models in terms of, rather than having low volume and high profit margin, they are really playing the economies of scale in terms of having very high volumes and lower profit margins. Now, for a large section of the hospitals, this becomes a feasible business model that they have adopted to. But the top tier hospitals that are there, they are still not kind of seeing the economics of this particular model. And that is why when we look at India's premier hospital chains, be it the Apollos or the Fortis, they have refrained from joining the scheme as of now. And I think it's fine, right? There will come a point in time wherein the economics will change, wherein the rates will increase, and it's a gradual progress. But I think the figure that I really want to bring into place is that currently PMJay is served by a network of around 24,000 hospitals, of which around 12,000 are public hospitals and an equal number are private hospitals, right? So you're really looking at 12,000 hospitals across the country which are catering to the population. And many of these 12,000 hospitals are actually located closer to the geography of where the beneficiary is actually living, right? So I think what is important is to bring access, affordability, and quality of healthcare as close to beneficiaries as possible, rather than really looking at onboarding the top 200, 300 hospitals. This is again kind of my view, but I think like this is the broader consensus that we've been hearing in the policy circles, and this is the broader consensus that we have heard from healthcare administrators as well, that it's a time-bound process, right? We do not want to just focus on those 100-odd hospitals, wherein we can really focus on 12,000-odd hospitals and get in quality and affordable services as close to beneficiaries and as close to patients as possible.
Thank you. I'm afraid we don't have any more time, but then I would really like to end the session with the last question, which I think a lot of most of us are also very curious about, which is from Hinata. Where do you think overseas entrepreneurs or policy graduates, like from the Hertie School, can contribute to the system? What's a good entry point?
Yeah. So Pranay, do you want me to take it from a startup perspective first, and then you
can take it from the startup perspective, and then I can take a shot at the policy.
Start from policy. Perfect. Awesome. Great. Yeah. So I mean, this is a great question, and I mean, definitely pertinent, right? Like, what do you do with a public policy degree after? So I think there's a couple of, I would say, maybe avenues that I had in mind. The first one was a lot of startups, do have existing, I would say, government affairs roles or regulatory roles that are relevant to, what the product is on. And a classic example of that is during my time at Zipline, which is this drone logistics company focusing on healthcare. I led the entry of Zipline into India, and my role not only involved, identifying how the solution is gonna, improve healthcare access in the country, but it also involved, what's the current healthcare regulatory landscape? How can, a drone solution, carrying medical products comply with the existing laws of the land with respect to, for example, blood transfusion, Like how can a drone carrying blood products ensure that it is in compliance with the blood transfusion laws of the country, right? As an example. So I think, there are so many different, I think, medtech startups, digital healthcare startups that do require a lot of support in understanding, how can we comply with the laws of the land, and, what is the, government scenario or, licensing for us. So I think that's kind of one big space. The second is, I think, where Pravesh is working in, where we work very closely with various healthcare startups and support them to understand the Indian market from a very comprehensive perspective. So not only looking at a product market fit, but also looking into what is the go-to-market strategy for such solutions to a particular market. So I think this is an extremely interesting space because, and I think I love my work that we do every day, mainly because I get to speak to so many different solutions, so many amazing like people and perspectives who just want to like do something that's interesting in healthcare and want to really create an impact in healthcare. So I think this is a very exciting space, looking into GTM opportunities for different startups in markets in Asia. The third that I want to specifically mention is there's a lot of collaborations that governments have embarked on. So you have, for example, Indo-German accelerators. There's a strong partnership between India and Israel to bring Israel innovation into India and vice versa. So here again, I think there's a huge scope to actually be involved directly with these entities, whether it's with Germany, Sweden, India. Like Sweden's another country I think that has strong ties with India as well. And Denmark. I think every European country has like a strong tie because everybody knows that India is kind of a land of opportunity. So I think this is also a space where tapping into some of these collaborative networks, identifying who are the right people, what are the startups that are going through these networks, would actually definitely be a great avenue. Post kind of the policy degree. So those are, I think, my kind of 2 cents on the three kind of avenues for policy graduates to contribute to the system.
Yeah, I'll actually combine Hinata's provocation question with the things that Kate has mentioned in the chat, which is really looking at like what are the avenues that policy students can focus on during the college as well as during the studies as well as after the studies. I think when we look at digital health in India, it's still a very nascent. It is still at a very nascent stage, right? Our digital health mission is just about a year old. There are still products and systems that are coming up. India as a country is still kind of really figuring out its way in terms of privacy, in terms of data protection. There's a personal data protection bill that is currently there in the Parliament of India for discussion. There's also a non-personal data protection framework that has been discussed, but is kind of is yet to be implemented at a broader scale. So really looking at like how do you make sense of personal data that you're collecting? How do you make sense of non-personal data, and how do you use data for decision making? I think these are open questions. And these are the questions that policy school students will be very interested during their policy years as well as after their policy years, in order to kind of figure out how do we kind of really bring in more knowledge and more context into how India can kind of move towards a better mechanism. For the digital health startups as well, while a lot of channels have been unlocked because of COVID and because of the urgency, I believe that there's still a lot of work that needs to happen on the compliance side, especially from a procurer lens, right? So one of the things that we did when I was kind of spearheading innovation unit at NHA was we created a category for digital innovations to get registered on India's government e-marketplace platform, which is like the Amazon for government in order to procure devices. However, it is very difficult for procurers to make a decision on whether one digital health provider or one digital health solution is much better than the other. How do you really gauge that, right? How do you really put in frameworks? How do you really put in rubrics in order to ascertain what is, which one is better, right? For physical devices and for various other products, I think history kind of gives you a lot of data points to really look at whether a Philips product is better than a GE product. But for digital health, and especially for digital health startups, I think this is still a very open area. In terms of really looking at the third thing that that really needs to be looked at is what are the regulations that are going to get that India should put in place in order for the entire data system to collaborate and talk to each other at a personal level, not only at a personal level, but also at a meta level, right? How is government making sense of data, right? Should the government kind of give that data? How are the data sharing protocols from the government to academic institutions, to private entities? How should those protocols look like? So I think there's a lot of opportunities, and there are a lot of open questions for public policy professionals to look at. In terms of specific opportunities, I think the GIZ has a very big mandate in terms of social protection in India, and I think it will be interesting to kind of scope out especially for the Hertie network, in terms of really looking at how are GIZ's needs and priorities manifesting, and how are their priorities kind of how are their priorities shaping up in India, and can Hertie really have an avenue into the GIZ network and can really do certain projects with the GIZ team in India. In terms of Indian graduates who are kind of graduating from Hertie, I think they can really, digital health again is a nascent field, and they can really use their studies in order to contribute to nation building, and in order to contribute to really building up those next gen systems and processes for effectively tackling the biggest problems that India is going to see in the next 10 years, which is going to be personal data protection, non-personal data sharing, in terms of what are the regulations that are going to be there for data sharing, and really in terms of how do you make digital health innovation adoption happen in India, right? The government has really set up processes and systems, but it is only going to be effective when the private sector, and especially the startups and the innovation sector, is going to plug and play into that system and is going to contribute to its highest levels.
Well, thank you so much, Pranay and Pavan. I think those are really very practical, very practical advice on how to get your foot in the door in this, very exciting space. So with that, I am, thank you so much for your time today. Thank you to the audience as well for dialing in from wherever you are. This recording will be posted on our YouTube page. So please, if you want to listen back to anything, just join us on our YouTube page, and also follow us on our LinkedIn page for future events. With that, I bid you adieu. Goodbye. Thank you, everyone.
Great. Thank you so much.
Thank you.
And sorry, if anybody wants to stay back for to answer some more questions, I think Pranay and Pavan, do you have 5 minutes? Maybe we can talk about Kate's questions, but for the rest of the audience, if you need to log off, please go ahead. Thank you so much, and thank you so much for staying over time. Thank you. We'll just give 30 seconds.
Sure, yeah, absolutely. We can stay on for a couple of more minutes, and if there are any questions, or I think if anybody also wants to reach out in any other way, happy to share the coordinates. Yeah, so I think it might already be in the chat, but if not,
So I just want to
drop a note.
Yeah, I just want to go back to Kate's questions on compliance.
Yeah, I think it's largely answered, at least from the policy side. Thank you so much. But then I wonder, like from the entrepreneur side, do you think the kind of uncertainty from regulatory landscape is because I'm asking this because it's kind of real life in China. Because like it was such a big movement and emergent sector to digitalize everything. And then GDPR came into the eyesight, and then it's kind of all of a sudden a big turn for uncertain regulation level global cyber security issue. So that's
actually I can take a crack, Ashley.
Okay, sure, please go ahead.
Yeah, go for it, Pranay.
And Kate, if I'm missing anything, Kate, there was slight disturbance this time around as well. But let me take a crack on the enterprise side. Pavan and I were actually chatting before the call on this. There's this concept of software as a medical device, which is very prominent in the West, right? You really look at compliance standards for a software like you would do for a medical device in our country, in terms of really looking at how is the consent framework working on. Is the software actually going to provide the advice that it intends to provide, right? Because there can be a lot of adverse effects, there can be a lot of hazards that can happen because of the wrong advice that a particular software can provide. So I think there's a lot more compliance standards that the Western countries already have in place. India, unfortunately, does not consider that till now does not consider software as a medical device, and there's a positive side to it and there's a negative side to it. The positive side to it is that you can really create a digital health company and get it going in less than a week, right? You create a software and kind of just roll it on the market. The negative side to it is that it is very difficult to gauge which company or which product and service is a better product and service, because you do not have a rubric to kind of evaluate multiple entities. And this is a huge problem, and this becomes a huge problem for a lot of digital health innovators that are there in the country, because what really happens is that they have to conduct a lot more pilot studies. They'll go to a particular hospital or a particular facility or a particular geography and get a pilot done. And when they go to a different geography in India, there is little value in the pilot or in the evidence that they have garnered in a particular in a different facility. And what it really does is what is known in the policy circles as piloting spirals, right? You just go in a spiral without finding necessary traction, and it just becomes a very frustrating experience for the entrepreneurs at large. So I think with the broader macro policy levers that are going to see a change in terms of GDPR, in terms of a bunch of other compliance mechanisms that the digital mission has gotten. One of the interesting things that the digital mission gotten is known as ABDM sandbox, wherein entities can really get their products and services and make them digital mission compliant. So I believe that the laws and the rules and regulations that the parliament is debating, plus the ABDM standard, is going to create the base level of compliance rules and regulations that are going to set the tone for regulations when it comes to digital health in India. But there's still a long way to traverse and a long way to go, especially from a procurer side, because you really don't have a very easy system to evaluate to digital health solutions that are coming your way.
Such a super answer, and sorry that I can't show my face because of technical issue, but I just want to say thank you so much, and it's so wonderful.
Thank you so much for
Great. Thank you, everyone.
I think this was such a great session, so stay tuned.